Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, Dr.
Happy
Mencia.
Mother's Day.
Oh, thank you. Happy Mother's Day. Well, I can say that to men too because, so many men are now mothering.
Yeah, absolutely. I have a good friend who he take care of his son. He's a single father. And, he is mom. He's mom and he's dad. So, yeah, I think Happy Mother's Day and to all of those parents that are single parents. By the way, today is Ina's birthday. So I want to say happy
wherever
birthday.
you are, if you're listening, happy birthday. We miss you here. We have balloons and everything, and you're just not here. We have birthday cake.
Yeah.
Why don't you blow out the candles, Ina? So, Dr. Mencia, I think we talked about the topic you want to discuss because it must be
being
serious
Mother's
for
Day.
you.
Yeah, it is. I lost my mom to a hemorrhagic stroke. She was on vacation, and usually when a woman goes to an emergency room with chest pain, or they got even more common to a primary care doctor, having chest pain or shortness of breath, in a women usually gets written off. It just it is not processed as we process it in a man. And having said that, then women with heart disease can be many times misinterpreted as a little girl. You're having a little girl. You're having a little reflux. And giving medication for your stomach instead of giving you an aspirin or taking care of you like we take care of the counterpart. And, do a stress test and do all the workup that the person deserves to have when they're having a heart attack, let's say. And, one of the questions you asked me before we went on the air is the heart of the men and the women, are they different? They should be the same, shouldn't they? And in reality, in my school of thought, is that the heart or any organ in a woman is different than that of a man. And the main reason is we have to look at the genesis. When we all come from two eggs, one cell from two cells, one cell from the mother, one cell from the father. And those two cells will merge and will start dividing and will start producing a human being eventually. But those cells, the division of those cells, the action that they take is due to the genes that they possess. And the cell have many parts. You have the mitochondria. It has many parts. It has the nucleus, it has the cytoplasma, but they are bad in certain chemical that we know very little about. And if you look at those genes, the genes are like an orchestra. They are there, you have the trombone and you have the piano, but when they come together as an orchestra, they play this beautiful music that some people will love it and be on their toes, other people will fall asleep, other people will hate it, right? Depending on who's listening. But when you look at what comes out of an orchestra, is this beautiful music, and we know a lot about music, and we understand, that's the trombone, that's the piano. We can break it into pieces. We don't know about the cells, and the men's cells and the women's cells. What we know is that they have hormones that that orchestra is producing. And when we are determined to be either a man or a woman, when the cells start dividing, they start producing these hormones, and these hormones will bath each organ for the rest of the human life. So imagine two eggs, two cells coming together, and you having twins. So they divide again, and now it's two humankind in the same environment. But one is a boy and one is a girl. So the boy will have hormones, and the girl will have hormones that will help in the development of those two creatures to develop, two twins, brother and sister in the same womb, developing and be so different.
So amazing when you describe it that way. It's like, how is that even possible?
And then, you take one of those creatures, you take the girl, let's say, because we're talking about Mother's Day and women with heart disease. You take the female and you stage her in their development. So when she is 4, when she is 11, when she is 21, when she is 45, when she is 105. So in those stages, you go through childhood, you go to teen years when you are developing as a teenager, you go into adulthood, you go into premenopausal, perimenopausal, postmenopausal. 105 is postmenopausal because you are way past menopause. But at all those stages, the hormones are never the same. When you are a baby, you are not ovulating. The ovary in a little girl, 4 years old, they are dormant. They are there, they are dormant. Why? Because they don't have the hormone to tell them what to do. But when she becomes 9, 10, 11, then other hormones take charge. And now the ovary will start ovulating. But be careful, because the way your body will do it is your right ovary will do it first this month, next month your left ovary, then your right ovary, then your left ovary. So they take turn when we ovulate. Now, you look at a woman that cannot have children, and they go to a specialist, and they get treated with hormones to help them ovulate. Sometimes, when we as humans interfere in human development, we don't come out as good as we want things to be, as Mother Nature can do. So instead of having one baby, we might get both ovaries to start ovulating, and you might have triple, quadruple, quintuplet. You have all these kids when you wanted to have a child. So what did we do? We try to mimic the hormones of the body, but we don't do as well as Mother Nature can do. So going back to your original question, is the heart of a woman and the heart of a man, shouldn't they be the same? And shouldn't heart attack when they present in both of them, because it is just the heart? Shouldn't it just be the same? And the answer is no. It is not the same. For example, a man, the classical picture that most medical students learn is the classical presentation of a heart attack is that you're going to get a person with chest pain, and that they sometimes, most of the time, can describe it as an elephant sitting on your chest, and very classically that pain tend to radiate to the left arm, and it will be accompanied by a cold sweat, nausea, maybe lightheadedness. And then they go through, how do you evaluate, confirm that this is a heart attack, and with the EKG, etc., blood tests to check for the enzyme for the heart, and start treatment.
Now, you've just described what a male would feel like if he's having a heart attack.
And most of the time, that's a male description, where you look at the female, but when when we study, this is the presentation. But we don't say, well, this is the presentation in a man. This is males, about females. Females is different. Their presentation is different. Why? Nobody even know. But I just described how the heart can be very different in a woman and a man. It's a hormonal. It's not that they have their connections are different than a man. That's why you can transplant a heart from a man to a woman or kidney from a man to a woman with no problem. Eventually, they will get adjusted to bathing in their new environment. But when the heart is where it belongs, where it was developed and accustomed to these hormones, all these female hormones, and that heart, when the heart is having a heart attack, the presentation of a woman is different. And I did a YouTube program a couple of years ago. It's called Women and Heart Disease / Dr. Mencia.
Really? It's on YouTube?
It's on YouTube.
Oh, I'm going to have to go look that up.
Women with heart disease / Dr. Mencia. And it's a video that we talk basically about the presentation of heart attack in women and how different it is from men. So, for example, in the women having a heart attack, a heart event, it could be an angina or a true full-blown heart attack. In a woman, it might present with numbness on both arms, jaw pain, back pain, and we all suffer from back pain. The difference is that there's a woman that never had back pain and get this back pain. And in that video, I described one of my patients that went to a dentist because she was having a toothache. That's how she described her heart attack. So she didn't go to the dentist. She called the dentist. So they set up an appointment. And she just so happened to be at my office on a Friday. And so they're going to see her the following week, because one of the dentists, not like us, that open on Saturday. So they were going to see her the following week to do x-ray and see what's going on. So she came to me and said, I said, we have a dental department up here if you want to go. Oh, no, I want to go to my dentist. They know me for years. I said, okay, that's fine. So what is going on? So she said, I have this pain and it just feel like a toothache. So I started asking, since when you have that pain? So he said, well, we were having company, me and my husband, and I was cooking. It was a big gathering. I was cooking a lot. I was moving. Had to go run to the supermarket, come back, carrying a lot of grocery that I'm not used to carry. Usually my husband will carry the groceries. So I'm carrying all this grocery. The elevator wasn't working. Thank God it was only 2 floors. So I walk up the 2 flight of stairs with all this grocery. And I'm listening to her. So I asked her, did you break into a cold sweat? And she goes, yeah, because I was working so much. I'm not used to working. Did you eat? She goes, no, I was nauseated. I guess I was working. So I said, okay, why don't you just lay down here? Let me do an electrocardiogram. She goes, no, but it's my tooth. I say, let me check your heart. And we did an electrocardiogram, and she was having a heart attack. So I said, okay, so where's your husband? Oh, he's at work. Okay, give me the number. So I called the ambulance, got her from my office straight to the hospital, called the hospital and said, there's a heart attack in progress. Called the husband. I say, she's going to leave her car here, come and pick up the car, and your wife is going to the emergency room. We saved her life.
Absolutely amazing.
And, and I even look into her mouth and I say, she has such a beautiful mouth. There's no way she have a cavity. And she never had a cavity in her life. So I look into her mouth. There's no inflammation of the gum. There's nothing. Beautiful teeth. We're taking care of teeth. And that say there's no, told me there's no way this woman having any teeth issue. This is something else. And then when I asked, and then she was good to describe all the activity that she was doing that she normally would not do. So, sometime in a woman, you might be now Mother's Day coming. Instead of people taking you out, you end up cooking for the whole family. And it become a lot to do. And when you are doing that level of activity, that is not what you are accustomed to. and you feel discomfort in your chest, it doesn't have to radiate to the left arm. It might radiate to the right in a woman. It might radiate to the jaw, and you think you're having some teeth issue. It might radiate to both arms.
Does your heart beat faster, or does it? Do you feel anything with your heart?
If you get anxious, if you get anxious, you might get your heart beating faster, which is no good, of course, because imagine a heart attack is a lack of balance between the oxygen supply, the blood distribution, and the oxygen demand by the muscle. So if you have the heart of an athlete, your heart will beat very slow. My heart beat in the high 40, mid 50s, because since a kid I always exercised. And sometimes when I had to see either anesthesiology or something for a colonoscopy,
they're worried about you because it's so low. Okay? You told me that.
So a low beating heart is a good thing, because then you are putting less demand on the oxygen, less oxygen demand to the blood supply. Where if you get nervous and you start having high palpitation, that's why sometimes people can get a heart attack making love. And there we go, making love.
We knew we had to get there on Mother's Day. That's almost appropriate.
Mother's Day,
right?
Don't forget that part in Mother's Day.
That's right. Don't forget the little love on Mother's Day won't hurt you, right? Hey, Bill, are you listening?
Get ready.
Get ready.
Mama coming home. So making love, some people that the heart starts speeding up. When they are making love, they can get a heart attack, in the process of making love. So anything that produces anxiety or anything that produces an increase in heart rate can make you more prone to a heart attack than things that would not, like meditation. So make love with meditation.
Okay, but wait, you did say something. If you're nervous about it, people should take an aspirin. Why don't you go through that? You once said that.
Well, yes. Because the aspirin is a blood thinner, and you can chew on an aspirin. When you chew on an aspirin, in the mucosa in your mouth, it start absorbing the aspirin, start being absorbed into the blood. But it's being absorbed not into the blood like when you take it through your stomach and your small intestine. They have to go through the liver. It goes straight into the bloodstream, into the circulation.
So you wanted to chew on an aspirin.
You want to chew on it because you want it to get fast to the heart. So if you take an aspirin and you chew on it, it will get to the heart much faster than if you swallow it. Because if you swallow it, you have to go through the stomach, get degraded, then it goes through the small intestine, get absorbed, then it goes through the liver, get processed, and then it goes to the heart. So if you chew on the aspirin, you bypass everything, and it just goes straight into the bloodstream, and it goes in.
And if you're not having a heart attack, it doesn't matter because you've just had an aspirin.
You just right. So if you're making love and you feel that pressure, go into the cabinet and like you're gonna clean yourself up in the bar. Chew on your aspirin.
I have to have an aspirin, right?
Okay, honey, let's have it.
But let's get back to that. So the big problem is not understanding that that's what's happening to you and putting it off. That's where the danger is.
Absolutely.
So
absolutely.
People, I would be that way. I would not want to have to call 911 or call.
But if you trust your doctor and.
But usually it's at night. So what do you do?
Take an aspirin.
Yeah, take an aspirin.
Take an aspirin.
But then.
And we have to keep in mind the heart is a muscle that. If it get damaged, it does not reproduce itself. So it will produce a scar, and that portion will be dead for the rest of your life.
Is that right?
The heart and the brain, they don't reproduce itself. They don't grow back.
Okay, so that means then you're living, if this has happened, you're living with some impairment in your heart, you're saying.
Right.
Is that, and then the oxygen can't get to the heart as much as
that portion. So depend on the size. If you can imagine a person having a heart attack, if this is the heart, if it's a small area like this, you won't even feel it. When they do an electrocardiogram, they say, oh, you had a silent heart attack. You have a tiny little area in the big heart that is dead. But some people that have a major heart attack that end up in the hospital, get up intubated, and all kind of things need to be done to them. They might have a scar this big, half of an egg.
And what will that? So that
well,
scar
that
will...
portion of the heart cannot pump. It can do nothing. It doesn't work. It's you carrying now this dead meat with you, and the heart is trying to work in harmony. Remember that the heart has 4 chambers. Have the 2 atriums and the 2 ventricles. It has 4 chambers. So depending on the size of that scar, if it take a lot of one of the ventricle, that ventricle cannot work as what the heart is supposed to do. The heart is a pump.
And we're going to I have to wait. I have to stop. I mean, this has been so interesting. For people who have just tuned in, if they don't know who you are, oh, shame on you. But let me just say, it's Dr. Andy Mencia. And, of course, he is the founder and the medical director of the AGI Medical and Dental Centers, one in Fort Lauderdale, one in Boynton Beach. In Fort Lauderdale, where he will be going right after this interview.
Yes.
He's going back for all his patients today. If you want a Saturday appointment, it's 954-489-1345. Again, that's 954-489-1345. And I was just talking about this with someone else, that home visit services, if you want that, they do have a magnificent way to take care of you at your home if you're homebound. And their website is agifl.com, agifl.com. And give us the YouTube that you've done this before. I want everyone to be able to see you.
It's women in heart disease, and then slash Dr. Mencia.
That's very interesting. So this has been a pet subject of yours, apparently, for a long time.
Yes.
I know you love
being
women,
a good
but
clinic, I love women.
Yeah.
With the love of my life.
Yes, but this is very important, and we hear this a lot about the silent. It's called a silent heart attack.
That would be a silent heart attack. Is you could be in your sleep and have a heart attack, and you won't even notice. You wake up the next day and everything is fine. It doesn't affect you. Here we go. Women's cardiovascular health. That's how it goes.
Women's cardiovascular health.
Yeah, women cardiovascular health. Let me turn this off.
Okay, and then it would say / Dr. Mencia.
Women cardiovascular health
fantastic.
with Dr. Mencia.
Oh, I'm going to look that up myself.
So when women cardiovascular
I see that
health
now,
with
I'm
Dr.
very excited
Mencia.
about that. That was on television that they did that.
And you get to see me on YouTube in a video.
Yeah, right. Well, you get to see him on YouTube with everything now. We're doing one every week. Let me also, just before we run out of time, ask you, though, about this. So when people die in their sleep, is that because they had a heart attack?
Good question.
So many people. Maybe this is for next time, right?
A lot of people die in their sleep. It could be a heart attack. It could be an embolism to the lung. It could be a massive hemorrhagic stroke, like my mother had, a big hemorrhagic stroke that will strangulate the brain and basically just kill you.
We have 1 minute. One more question. So if you die in your sleep that way, does it necessarily mean that were you sleeping when this happened and you maybe didn't even feel anything?
You won't feel anything. It's the most peaceful death.
Okay,
most peaceful death.
Okay, well, this is Mother's Day tomorrow.
Happy Mother's Day.
Yes,
take care of yourself.
Thank you. Yes, and come down to see Dr. Mencia if you're having any problems. I just can't tell people enough what the great experience will be when you get to meet.
And for all the single moms out there, look at your offspring and have a wonderful Mother's Day. Yes. You have the most beautiful gift God can give you.
Yes, it's having your children. We're going down to the triplets on Sunday, so that's going to be exciting.
Cool.
Talk about 3. Thank you, Dr. Mencia, as usual. It's wonderful
Always,
having you
Anita,
here.
always.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.